Hey there, good evening everyone. We are back with I Care for Your Brain with Dr. Sullivan. I am a board certified neuropsychologist and I am here to bring you science-based information about all sorts of brain health challenges. And specifically, we talk a lot about the emotional, psychological side of living with brain health issues. I try very hard to be objective and provide you with hype-free information because I really think that knowing more about what you're living with is a form of empowerment and really helps to take away some of the stress of having a brain health issue, because you might not be sure what symptom actually makes sense with what I'm going through. And ET, what we're going to talk about tonight, essential tremor, really falls in that category because a real transformation is happening in the way that brain health providers think about ET. As many of you know, it was often thought of as merely an action tremor for a very long time. Thank God we're starting to move beyond that, but what you'll see tonight in our talk about aging and how the age of onset when people start to have symptoms is being used by the scientific community to dig deeper into the reasons why people develop essential tremor. So when we were together last week, what we focused on was progression of symptoms. What makes essential tremor get worse over time? So if you haven't watched that one, check it out. It's in the archives. And basically what we came up with is that we really don't know, and it just seems to be a matter of age. We know specifically where in the brain we think essential tremor is primarily happening, which is the cerebellum in the back part of the brain, which has historically been thought of as our balance center. And now what we know is it does so much more than movement, so much more than motor symptoms helping us move our body in space. It's really the great coordinator of all systems, cognitive, emotional, and physical. And when I talk with people who have ET in my practice, I hear so many times that it's so much more than just the shaking that you can see in my hands. I have trouble managing big emotions. I have trouble with rapid recall. And really, once you understand what the cerebellum does, this makes a lot of sense. And so we spent some time together talking specifically about the cerebellum. And what we're going to really try to focus on tonight is a little bit more into the whole idea of when people start to get symptoms, and does that mean that we're really looking at multiple different diseases here? We know that there is a spectrum of different types of symptoms that happen in ET. You know, some people stay the same over time, some people get progressively worse. Some people seem to have the tremors take place in different parts of the body. We have people that get it from the time that they're in their toddlerhood all the way up to in their late 90s. And so scientists are really trying to make some groupings, make some general categories of where people fall in as really the first inroad, because what you're going to learn tonight is we're not very far in terms of the genetic study, which is really the key thing that needs to happen, the breakthrough that we need to really start to talk about things like genetic therapy. So like I said at the beginning, we are starting to make some progress in terms of the non-motor symptoms being validated in ET. And the big one that we see is coming out of the Tremor Investigation Group. And you guys should know that this is the group that makes the criteria for essential tremor. And most recently, just within this last year, they came out with this new category called Essential Tremor Plus. And I've done a talk on that too. You can see that if you're interested. And basically, they just wanted to come up with a new category that validates that there is a subgroup of people who seem to struggle with cognitive issues, meaning that rapid recall, specifically of words. So part of my perspective as a neuropsychologist is they're just capturing people who are vocal about it or people who have it beyond mild. Knowing what I know about the cerebellum, I would argue that almost all people with essential tremor, especially over time, start to have some of these coordination issues with other things than just necessarily their hand or their head or their vocal cords. So thank goodness we're starting to move towards more validation, but we really do have more unanswered questions than we do answered questions at this point. So one of the things this consensus group really left us with, some food for thought, was, are we really looking at one disease? Is essential tremor just one thing that has one cause and one core group of symptoms? Or are we looking at something that is really multiple diseases that are very closely related, but there are some key differences across people. So one of the ways that researchers start to make inroads in figuring these things out, the more complex, the more you have to make sure you know the basics. They just try to look at characteristics of the group, right? So what are some things that seem to happen in essential tremor that, if we started to study that, maybe we could figure it out. So one of the things that stands out with ET is the age at which symptoms started, which we often call age of onset. And so there do seem to be 2 peaks within the lifespan for when ET starts. Now, this might not relate to you personally, but these are means, and we're looking at the average when you group people together. And there's what we call a bimodal distribution. So there seems to be a peak in our 20s and our 30s, and then we have less and less people getting diagnosed. And then when we go up to our 70s and 80s, we see another peak. So we've got these 2 peaks here. So one of the questions is there something about that? Is there something about aging? And so the way the scientific literature cuts it is basically what they call younger age of onset, early onset, or later age of onset, late onset. And there's really no agreement in the scientific community about what is this age that is the dividing line. You'll see 50, 65, 70. As we get older, though, many of you know this or you've been told this, the older the person is when they start to get ET, the more I have found that it gets called age-related tremor. And I worry about this labeling, this diagnosis, because it kind of sounds pretty benign, right? Like it's no big deal. And so one of the things that it makes me concerned about is that then people aren't getting the correct diagnosis, which means they don't get to learn the correct education about it. Maybe some symptoms are not being validated. And then they kind of fall into, the spectrum of some symptoms not being taken seriously or ignored because, that's just kind of age related. It's almost like this wastebasket that we can just kind of throw the symptoms in. So when we start to think about breaking up ET into early onset and late onset, the first idea is, okay, how are these people the same or different? So the big difference seems to be family history. So if you start to look at early onset, the vast majority of these people, over 80%, if you get the symptoms before the age of 40 in most studies, they report having a first-degree relative that also has ET. So this would have to be a parent or a sibling. The only other thing that's different about early onset ET seems to be the way the body, the tremors, respond to alcohol. So people who have younger onset seem to get more temporary, short-term relief from taking in alcohol into their body. Folks who have ET later in life, so in these studies, age 50, 65 or above, have less family history and maybe seem to have a faster disease progression. But again, I'm not super convinced about that one because there's many reasons. I think there's 60 reasons or so why people can have a tremor, and a lot of them have to do with medication. So if you think about getting older and maybe having ET, the tremor could also be worse because you're also taking medications that might make the tremor worse too. So to me, I'm not entirely sure that it's necessarily the ET that's getting worse, or is it maybe they're taking other things related to getting older that are making it worse. I hope that makes sense. So what we really think is happening is, if we go by the scientific literature, is that it has a lot to do with genetics when you start to get your symptoms of ET. So I want you to hold on to that because near the end of the talk, we're going to come back to talking about what I know about the genetics. So if we talk a little bit more about early onset though, even though the mean is in our 20s and our 30s, there are children out there in their toddler years that have been diagnosed with ET. We think it's maybe about 5% of children, and really what the science seems to focus on, and rightfully so, is the social disability that goes along with having tremors at an early age. We think that about 20% of the kids who have ET have what we call a kinetic tremor, and so this is that the tremor is only there, when the hands are actually in motion, action tremor, and that about 5% we think have a postural tremor. And what this is that you can really only see the tremor when the hands are outstretched. So really it only becomes apparent during specific circumstances. Head tremor in kids who have ET is relatively rare, and we think that that only happens within 5% of the 5% who have ET as a kid. again, the functional impacts, the everyday effects of ET in children are what get the most attention in the scientific literature. And they get worried because things like, using utensils, writing, playing an instrument, drawing, holding cups, these are the things we know that with an action tremor are particularly difficult. So the question becomes, if a child has trouble with those things, are they really going to meet developmental milestones, either because they actually aren't doing the activity enough, or a lot of kids then avoid doing things that promote the tremors, particularly in public or at school, because they don't want to be made fun of. And so there's a lot of good work being done out there to try to support kids who have essential tremor in doing things despite the fact that they might shake while they do it. If you look at the frequency of tremor within the early onset of ET, there does seem to be a distinction between ages about 7 to 12, and then once you get more in your teenage years, which is more like 14 to 16. And some of the differences that I was reading about have to do with holding objects, specifically if they're above a certain weight. So in that 7 to 12-year-old age range, they, in one experiment, gave children a 300-gram weight to hold, just kind of on the tips of their fingers. And what they found was in that 7 to 12 age group, it really made the tremor get a lot more, frequency of the tremor got a lot more big, but when they did this in adults with ET or in teenagers, they didn't see the same effects. So this made me think about, well, when you're 7 to 12, what are you doing that you're holding with your hands? Well, you're thinking about holding books for school, right? Made me think about the weighted utensils that we sometimes give folks with ET, hoping that it's going to help them be able to manage utensils better. So knowing that they used the 300-gram weight in the one study, I wanted to find out the weight of most weighted utensils. And it seems to me they clock in at about 225 grams. But even still, it may be, in a weird backwards logic kind of way, that weighted utensils for younger folks with ET actually is making it worse. So that was kind of an interesting finding. We think that ET in children is more associated with some other movement symptoms like tics or dystonia, which is muscle spasms that last more than, your typical Charlie horse or your leg cramp. We know that an overactive thyroid gland in children can make ET worse. So very important, if you're listening and you have a child with ET, you want to also make sure, because we don't typically do thyroid panels on kids, right? We think of it more like middle-aged women. So we want to make sure that people's kids' thyroid hormone levels are level. There's not a lot known about how treatments may differ according to age in ET. So typically smaller doses of propranolol are given, so about 20 to 60 milligrams. There are no really good clinical trials that look at essential tremor in children. It's definitely gets a stereotype as being more of an age-related condition, which is really frustrating for kids and families out there, I'm sure, who are living with this. So one of the other things they wanted to look at in the scientific literature was actually the brains of people who had essential tremor. And what they wanted to do was to look at these younger versus older folks to see, are there any differences in the cerebellum in the brain? So in 2017, they actually had access to a lot of brains that had been donated to something called the Essential Tremor Centralized Brain Repository, which is a collaborative effort between Yale University and Columbia University. And they looked at 30 early onset ET folks who had passed away, 30 late onset ET folks who had passed away, and 30 controls, meaning that their brains had already been proven to be free of ET, of Alzheimer's, of Parkinson's. And they used the cutoff of 50 years old. So if you were 50 and above, you went in the older onset group. If you were 50 and below, you went into the younger onset group. And what they found is there were absolutely no differences in the brains between younger onset or older onset in the cerebellum. So then what they did is, because this was such a new study, so recently happened, they decided to change the cut point. So they said, well, why don't we call early onset 40 and younger? Why don't we call late onset 60 and over? So they kind of stretched out the timeline, and they still found no differences in pathology, brain changes that were happening in the cerebellum. So they concluded that If you actually just go by cerebellum, there's actually no difference whatsoever. We're not looking at two different diseases here. So the conclusion that they came to was that it has to do with genetics. How high is your genetic load for having essential tremor? And so that's where I was saying before, remember this concept of genetics, because we have to understand that a little bit more to really get into understanding the age at which ET seems to happen. So, genetics is how we inherit all of our traits, from our eye color all the way to different diseases. When we inherit our genes from our parents, we can either have, normal genes that operate perfectly well and do everything they're supposed to. We can have genetic mutations, which means it is inevitable that you are going to get that brain health condition no matter what. Or you can have a genetic variation, which means you may get it if something in the environment turns on that gene. So my understanding of the research right now is that most scientists who study ET think that early onset folks simply have stronger genes, meaning that the disease reveals itself earlier in life, and that people who have the later onset are people who had a variation, a genetic variation, but there was something in the environment that turned on the genes. And of course, just like late onset Alzheimer's and later onset Parkinson's disease, this is the lottery ticket. This is the $64 million information we all want to know. What is it in the environment that is turning on these genes? So what is some of the evidence that tells us that early onset is very strongly genetic? Well, we know that in twins, if you're an identical twin, you will have a 50 to 90% chance of your twin having essential tremor and having it start at almost the exact same age. And so that seems to make sense, right? But hey, what about that other 50 to 10%? We know that there are people out there with ET who have no family history that's known. We call these sporadic cases. There is a lot of variability in the age at which the symptom seems to start. And so we have to really explain it both ways. There must be a genetic cause, and there also must be something in the environment that's happening. So what we know about essential tremor is that we think that it is really passed down primarily through what we call an autosomal dominant mode of inheritance. This means that if one of your parents has that abnormal gene and you get that gene, you are going to get the disorder. You have to have one gene from one parent and another gene from another parent, and if you kind of get unlucky twice, then you're going to have the disorder. That's not the way we think ET works. You just have to get it from one parent. So the question then, of course, is it just one faulty gene? Is it multiple faulty genes? And the only way we're going to answer that question is by figuring out what really is ET in real life. What is the actual clinical disorder? And like I told you before, we're just making inroads here. This just happened a few months ago that the consensus group came up with ET+. So that really makes the genetics hard, because first you have to say these are the symptoms that go along with ET, right? So they did do some genetic exploring of ET, but it was in 1997 and 2001, and this was back when you had to know what you were going and looking for in terms of genetics. This was before the whole genome sequencing invention happened. Now we have a much greater ability to go in and sequence the whole gene and the whole gene family in a person and be able to know where the breakdown is. But the truth is, we don't really even know where to look, because the experts in the world can't decide exactly what ET is in real life. And so that really brings up the idea of advocacy, which is for all you folks out there affected by ET to really make sure you are communicating with your doctors what you think are all of your symptoms. That's kind of the path, right? We need the patients to tell the doctors, who go to the conferences, who tell the researchers, who get the money to study these things. So please feel entitled and empowered to tell them if you feel like you struggle with word finding issues, if you struggle with big emotions. These are the other things we have to understand about ET. We can't just leave it to what is visible, what is testable, what is observable, right? Because that's how we got into the pickle that we're in now of assuming it's just an action tremor. There's of course so much more happening behind the scenes within the person that we have to really bring out and validate. So we have no genetic testing that's available for ET now. We do know about one gene called 2p2-25 that's on that chromosome that we think has a lot of potential for us unlocking the genetic code of essential tremor. There's definitely a lot of really important people working on it, but all the papers that I read basically said we first have to understand the clinical phenotype. So what that means is what really is essential tremor, and that's what's going to 30 to 50% of people who have essential tremor, we think that they actually have Parkinson's disease. We think that they actually have dystonia. So again, the researchers just keep pushing us back to let's get it right in the exam room, let's get it right in the doctor's offices, and that will point the way, that will give us the keys to know exactly what we're going to look at genetically. So unfortunately, it's really not much of an answer, but I so strongly believe in your experience as someone with ET that I really want you to write in the comments here and help me understand, what do you think? Do you think ET is really one disease? Do you think it's two, maybe an early onset, maybe a late onset? Do you think it's actually much more than that? What do you think are the key core symptoms of essential tremor? Now, of course, no two brain conditions are exactly the same, but surely we should be able to come up with, 5 to 7 to 8 different core components that may exist on a spectrum for most people, but it's really, really important that we figure out similarities amongst people who have been diagnosed with this disorder. I know that many of you out there are listening because you want the very best information and you want answers. So when I start researching a topic for you, I go into it hoping, assuming that I'm going to really be able to find the keys to understanding and to be able to share them with you. Essential tremor is frustrating because that's not really the case. It's not the case genetically. We're still not really even in agreement with all of these subcategories. So I can't even imagine, for those of you who live with this, how hard it must be to feel like your doctors really get you, to feel like people understand what it is like to live on the inside with ET. So please tell me, help me understand as a neuropsychologist, how can I relate better to your experience of having ET? Okay, we started last week with a special I wanted to just end with. This is talking about the importance of reducing any risk factors that all folks as we're getting older have for less than optimal brain health functioning. So the idea is maybe essential tremor is a risk factor for brain changes as we get older. Well, if that's the case, then you better be darn sure you know everything about diet and sleep and exercise and stress and the importance of being social. And so a few months ago, I came out with my lecture series, which is on our website, icareforyourbrain.com. And these are different than what I do here. It took me about 2 years to put the time and research into them. They are professionally shot. They're about an hour long each, and the idea is really to educate you on the 9 pillars of brain health as we get older. So we're going to have an ongoing special, just $5 each to download those at the website, which is ICFYB, icareforyourbrain.com/ET. I will be back on August 21st, and I'm going to be talking about the power of music for brain health, such a underutilized modality for healing and motivating, and more it's getting attention. So I want to share with you everything that I know about it and maybe inspire you to bring more music into your life for better brain health. If you thought this was helpful, if you enjoyed learning about essential tremor at a nice high scientific level, I would love for you to share this lecture on your Facebook pages with friends, any support groups you go to. It really is just about sharing experience and expertise. So you all help me understand what it is you go through, and hopefully as a brain health provider, I can help you understand some of the science side of it all. Thank you guys so much, and I'll see you next time. Bye-bye.